optometrist, Dr. Sutton Nichols. We don't know a lot about her. She's not very well known. Good luck Googling. However, there are some literature that she has written in our archives in our optometric organizations, particularly the Optometric Extension Program. I first saw her classification system written by Dr. Elliott Forrest in the book Stress and Vision, and was just, it's like a light set off. So when I talk about my seeing spaces protocol, where we look at the space and not the actual object, objectify the space that the object is in and let the object become a consequence. And then I saw a depiction of her work. I've used that to develop our own visual spatial activity to try to show someone that how they see the world is going to influence the level of clarity at which they see it. And by changing their perspective, they can learn to change a little bit of the clarity that they have. And what Dr. Sutton Nichols has done, especially with among the myopes, she had classified B1 versus B2. And when we see this in the her work listed in her literature, and that's reprinted in the book Stress and Vision, a light bulb went off. I'm like, wait a minute. Just simply looking at the spaces is not enough. We need to look at the space of the world. And she came up with this system regarding space based on a mirror system she set up, something I'm still working in to delve into and how she did it. I joke around in my office and I will say, now let me get the best piece of equipment we have, the foam board. Lovely. This is literally my favorite piece of equipment in all of our offices. Now, there are streaks on this foam board. The wider the better, but this is what I have to work with. So if I get a white one, that'll be my new favorite toy. Okay, so I'm gonna put my hands here and I'm gonna instruct my person, my patient, or my client, whoever, that I'm going to look at this space. I'm gonna use my imagination and say, this is a square. And I'm gonna look at that square or that space exactly like I would looking at my hand. I'm going to look at that space like I would any other object. I am now putting my value on the space. This space is much more valuable than my hand. And I'm gonna grow that space and keep objectifying the space as it grows. And I'm gonna note how that feels in my vision. And then I'm gonna shrink it. I'm gonna shrink it, I'm gonna shrink it, I'm gonna shrink it. And I'm gonna say and declare to the person, there is a difference in the way it feels. Can you find the difference? And in my experience, the more myopic they are, or the more esotropic they are, or the older they are, it becomes much more difficult because they've habituated the way they use their vision for a very long time. So there's a difference. There's a shrinking and there's a growing. I call it stretching. And I'm imagining my space growing up here as I do this. Shrink, grow. Shrink the space, grow the space. Oftentimes, and children usually get it faster because they haven't had so many years, right, to habituate it. Shrink it, grow it. Shrink it. And I'll say, well, how does it feel? And if they don't exactly know, I said it can be vague. It doesn't matter. Just find me a difference in the feeling. And oftentimes I'll able to finagle out, okay, this one feels a little looser as it grows. Or like today I had a patient that say, it feels more of a push feeling, while this feels more of a pull feeling. Or loose, tight. Just because you like the tight feeling and it may feel more comfortable doesn't mean that's what you need. So I don't care if you like it or not. This is a looseness or a softness or a push. This is a pull, a tight, or a squish space. You need to learn to oscillate the space because our vision is an oscillatory dynamic system. And let's grow that space. And then can you see the entire space is one thing? Does that kind of feel like the push or the loose or the soft feeling? Yes, it should be. Otherwise, you're not doing it right. And then I'll say, now zoom in and study the texture. Study the detail of the texture. Dot, 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 around. And they will say, now, is that similar to the pull feeling? I said, yes. Now go back and grow your space back out again. Yeah, grow that space out. Now that we understand the shrinking and the growing space, I'm going to suggest you go watch my video on zooming. The zoom in, the zoom out, the zoom in, the zoom out. As we see from Dr. Sutton's illustration of B1 myope versus B2 myope versus hyperope. The hyperope is the normal. We want to be a little hyperopic or farsighted. Not a lot, but a little bit. This is the B1 myope. They didn't have computer screens back in the 1940s, but this is how she presented it. They're looking at a screen. And that's always been my thing. When I'm trying to do Bates method swinging back and forth, the long swing, I'm trying to get the picture to move in this direction. And my goodness, is it nauseating. And it never really helped me, the Bates method long swing. The B2 myope is like this. They're selecting their space along the y-axis as they look. And it's more of a squished perception as they look. Another way I describe it is a cursor, like a computer screen, but your space is in a cursor. You're going to cursor everything in your vision, but it's really good for detail. But that's been my experience with most high nearsighted people. That's how they see, and it's like to the detail. And you're going to ask them, okay, let's talk about zooming out. And the next question is, well, where do I look? And to them, looking is bing in one little spot versus a low power myope or hyperope. They don't have much problems with this. Other people who are bing lookers are people with esotropia. But anyway, this, they'll say, what's the difference in the feeling? Is this more of a push feeling, or is this more of a pull feeling or a tightening? Now this versus this. My hyperopic patients, when I demonstrate this to them, they can't stand this. They feel that. But then I say, now can you find that difference between this? Expand your space out, keep that space. Now we're going to pull it down here. And notice what that feels like. Again, you got to target the feeling if you're going to make any type of progress, because you have to understand what your body is doing, what it's feeling as you go through this. Then up and then down. Keep that space. Your whole perception is one big object. You don't want to target any detail or any texture. Can you feel the difference? This is finding the just noticeable difference between the B1 and Sutton Nichols presentation and the hyperop and Sutton Nichols presentation. Is this more of the loose feeling or the tight feeling? Now, it may be tighter and it may be more comfortable, because if you're used to tightness, looseness feels uncomfortable. If you're used to wearing yoga pants and then you tend to want to go, you suddenly are going to wear linen pants, well, that looseness is not going to be exactly comfortable. Another good analogy is boxers going from briefs to boxers. You know, the looseness feels weird. So, but you have to embrace that difference in feeling. But can you find the feeling? If not, intensify it. Make the difference greater. That's what I have them do. Pull it out a little bit, and now intensify it. Look at the detail, and then grow the space as we pull it away. and do that. Put it down. What we want to be is we want to grow that space. Grow the space. We have a space on the floor. We want to grow that space. We're stretching the space of the floor, just like the hyperopen and Sutton Nichols demonstration. We're going to grow it. We're walking back. We're going to get our lay of the land. That should be our most primary concern. Get the lay of the land. Feel it grow. You're going to still pair that feeling that you got, that looser feeling. And then we're going to walk up. And we're going to feel it shrink. We're going to get that feeling of tightness. Doesn't have to be a lot, just a little bit. If you can't feel it very tight, I'm not expecting super tight. You're going to go back. And we're going to feel it grow. We're going to do the same thing. Space shrink and space grow. Now I'm going to look up. I'm still going to be aware of the space here. And as I walk up, I'm going to feel the space shrink down below. And I'm going to feel the space grow as I go back. Walk back. I am paying attention to the entire border of the floor as one object. It is one big space and platform, and I am not looking here on it or looking there on it, dotting my R's around like some computer cursor. I see the entire space as one object, like I would at any other object. I want to see big. And then, as I walk forward, as I feel the space shrink, because this ZX axis floor space is more important, secondarily, I'm going to watch the space of the wall, the big space of the wall, not anything on it, grow. And then as I grow the space backwards, the floor space is going to grow again. I'm going to observe secondarily how the wall space shrinks. And then I'm going to walk up again and I'm going to experience the floor space shrink. Secondarily, the wall space grows. And I'm going to ask the person, now are we in zoomed in or zoom out? And by this point, most people understand zoom in. And then I'm going to go back. Say, now what are you doing? Are you seeing? And they'll say the wall is shrinking as I grow the space. So this is how you practice zoom in, zoom out. My spaces don't work when we are zoomed in. It doesn't work. So if you're having trouble with any of my activities, if you decide to put them at use, at your own risk, of course, because I don't know your particular diagnosis, and I'm not your particular doctor. But anyway, spaces don't work when they're zoomed in. I have a patient that sees double of everything. And this works really good because if you zoom in, you're going to notice your double vision probably gets a little worse. Or the blur will get worse. It makes nothing better, actually. It should make it worse. And then you learn to zoom out, it kind of gets a little better. It might get a little closer together. But for my double vision people, if they can't make any progress, I'll go straight to the doorway. Kudos to my colleague, Dr. Kavita Malhotra, for giving me the idea on this. I really think it's amazing. Thank you, Dr. Kavita Malhotra. Love you. But we'll do the same thing. Yeah, they might see two pictures, two outlets, two of everything. But then I'll say, okay, I'll teach them the space stretching with the foam board. But we go big. How many spaces do you see? If it's only one, then it's too small. We go big. Once they get the idea, look at the doorway space. How many doorways do you see? One. But there's two TVs. Forget about the TVs. How many doorway spaces do you see? One. Good. Think about that doorway space. And as you approach it, does it get bigger? You're zooming into it, yes. Does it get smaller? approach it, watch it get bigger, watch it get smaller. Now, floorway space. You know, you can use garland, you can use carpet squares, whatever you need to do to isolate a rectangle. And then say, shrink the floor. How many floor spaces do you see? Or are you aware? Or, if it's still double, how many floors do you see? Okay, there's one floor. Okay, good. Shrink the floor space and watch this doorway space grow. And then back. The whole goal is to get the zoom in, zoom out feeling. Once you get good practice at the zoom in, zoom out, then I can take the person to a Snellen. Why a Snellen? Because it gives you clear feedback. And I usually get them at a distance that's close enough for them to be able to make out the top 3 lines. And once they understand zoom in, now we have a language we can go off of. They'll zoom in. Can you make it blurry? All right, once it's blurry, don't get stuck. Think about the floor space. Start thinking about the floor space. Grow the floor space in your mind. Can you change your attention off of the chart and then into the floor space? You know that there's a ground or a floor on the other side of the wall. Think about that and see the floor with the wall coming up from it. And once you do that, does that reverse a little bit of the blur that you induced? Then you are starting to oscillate your visual perception. And that's what we want. We want the dynamic interchange between that. Now zoom out, and instead of looking at the letters, look at the spaces. You want to grow to see the entire space between the letters and get to a comfortable distance to where you can see the first few lines, maybe the first several lines, whatever distance that is, and think about the space. When you think about the space, do not dare give your permission to look at the letters, because then you're going to shrink your perception. That's what's going to happen. Don't do that. Zoom out and follow the spaces and answer. Do the letters kind of fluctuate? That's what I'm looking for when I'm doing this instruction with my patients.